And then all today we have with us Dr. Hemraj. He is working as Associate Professor, Department of Pharmaceutical Sciences, City University, Shahpur campus. And today, Dr. Hemraj is going to talk about a proud to a topic called "Proud to be a Pharmacist, a Pharmacy Practitioner," as a pharmacy practitioner. So I welcome you, sir, from the behalf of ISF College of Pharmacy. And now you can start with your presentation, please, sir.
Thank you so much, sir, Dr. Ramesh Sharma, and I sincerely thanks to Chairman, sir, Dr. Praveen Datti, and again, most worthy Director, sir, Dr. G.D. Gupta, sir, and Dr. R.K. Naran. I would my sincere to thank all my pharmacy practice faculty colleagues also and students. Thank you for giving this opportunity to talk with you on this dialogue series on this one of the particular topic, which is most significant one in nowadays, which is let me show my presentation whether it is check whether it is visible or not.
अभी नहीं दिख रही है, अभी विजिबल नहीं हुई. स्क्रीन शेयर कर दो.
Just a minute. Sir. Is it visible, sir?
यस सर,
Okay, thank you so much.
अब विजिबल है.
Okay, no.
यस सर, यू कैन स्टार्ट.
Just a minute, sir. Let me manage the screen first. Okay, thank you so much, sir, for this particular dialogue series. As far as the pharmacist is concerned, uh, we generally say to our students and colleagues that proud to be pharmacist. Why we say this to students? Why? What is the significance of proud? So first of all, I put my uh, introduction that I'm Dr. Hemraj from City Group of Institutions, Shahpur. Uh, I'm Associate Professor in the Department of Pharmacy Practice. So, as far as the topics is concerned, this is one of the significant topic because whenever you prouding yourself, when you feel proud in yourself, what will happen? It will change your aptitude. It help in aptitude of practice. So aptitude is necessary component when you're practicing in whether you are in industry or in the healthcare setting. So what is the meaning of proud first of all? It's feeling deep pleasure and satisfaction as a result of one's own achievement, qualities, or possession of those someone with whom one is closely associated. आप या आपके कोई भी रिश्तेदार जो भी आपसे डीपली एसोसिएटेड होता है जब भी वो कुछ अचीव करता है जो जो उसकी अचीवमेंट्स हैं ऑन दोज ही फील्स अ डीप प्लेजर एंड सेटिस्फैक्शन मोस्टली this is a not type of ego. This is type of happiness you are feeling at that time, and this particularly change your put some inputs in your attitude when you work in your colleagues and some other uh, uh, the team of your healthcare as well as your industry people. So second one part of my title is as a practitioner. So what is the practitioner? Practitioner is whatever you practice. So a person actively engaged in an art, discipline, or profession, especially medicine. Patients are treated by skilled practitioners. We generally say this. So What is the practitioner who practice? So now, what is the practice? Practice is an intervention with a known positive outcome. So there are two different meaning. When I a number of times ask the students, what do you mean by a physician practitioner and dental practitioner? What is the meaning of practice? So what answer I got many times is they are relating to the sports events. So the preparation before any objective. The preparations made for to achieve any objective, that is, they generally correlate. But in this case, whatever we are addressing, the practice meaning of practice here is, so whatever you intervene, whatever you are doing, or your skills are going to input in that particular time for a one particular event, that is, you know what the outcome will come, and that should be in positive nature. That is not should be in negative. That is, result should be in positive. So whenever doctor is prescribing any medications, or a different number of patients are coming to the same clinic, and he prescribing some particular medications. Those medications are prescribed on the assumption, on the experience, on the competencies that this particular case set of medications will come up with positive outcome. So that's why we are uh, use this particular term, that is practice. So proud is directly associated with your practice and practitioners. So what why we feel proud now? What is the reason behind to feel proud? So some people are coming from medical backgrounds with medical plus two qualifications, some with non-medical plus two qualifications. Some are coming with a diploma, so with the lead pathway for the graduations in pharmacy. So every student have different assumptions while they are entering the pharmacy degrees. So what is they are thinking that the pharmacy is an allied professional for the healthcare, or this is an optional one. We could not get the admission in medical schools, and that's why the second option is your pharmacy. Maybe the second option is your Ayurvedic degree. These are the substitutions for the alternatives degree for the medical substitutions. So why it is so? As far as this topic is concerned, so feeling proud on the basis of what you will gain. Why you? What are the positions you will find in your profession? Pharmacist most particularly is required to be registered with some government body. So what is the registered pharmacist? It should be standard role with a registered registration with all necessary certification and degrees, and must be registered with the government, central government body. So that is particular one entity which is required for to enter and practice in pharmacy. Now, what is the role the pharmacist is going to play in most of the different situations? One is the two scopes we are having. One is industry. Second one is the public health, that is through the hospitals or healthcare industry. In industry, what we do is major global industries are many in nature, but the pharmaceutical industry play a major global impact in public health as well as the world economies and understanding of human biology. So pharmaceutical industries need to employ highly educated pharmacists and expertise from the pharmacies. So pharmacy graduates and postgraduates and doctorates are required to be placed in the this industry, particularly with a registration with the government bodies. So, what are the various positions? Namely, there are a number of different names and positions are there in different countries, but some commons which we have mentioning here is pharmacometricians. Those handle with the mathematical aspects of industry by managing and interpreting data on the drug, disease, and ongoing trials. So whatever the materials used, whatever the technological issues are going on, and that what are the developments going on, the new technological issues. They all are, in terms of mathematical aspects, are dealt by these pharmacometricians. So the goal is to ensure the industry possesses the such much information as possible by conducting experiments on these pharmacies and to identify and solve the quantitative problems in the medicine. So quantitatively, this is the one of the positions which is very paying in a number of industries. This is rare in India, but internationally this is the good. So second most, we see the most pharmacist managers. These are the chief pharmacist positions in different pharmacies. Pharmacist managers act as the lead pharmacists, focusing on more on the business side, while also ensuring the drug proper storage and for the principle of the care. So these pharmacists take prescriptions from the external source and fill them for the patients, ensure that they have the proper amount, proper count, and the correct amount with the proper instructions also. So pharmacy managers are often business owners rather than they are employed in most of the multi-institution companies. So next one is pharmaceutical physicians. So doctors are also working in many pharmaceutical positions, but these are the pharmaceutical doctors who are they are the doctor physicians who are expertise and skills in the pharmacist knowledge. So doctors also need uh, after degree those people who are saying thinking that they have not cleared their need, we were willing to go for the medical profession. They need to go and get the pharmacy skills for the pharmaceutical physicians. And these physicians work in every sector of the pharmaceutical industry to help with the marketing, regulation, research, and advertising of major of the companies. So pharmaceutical physicians is the backbone of the industry knowledge. That is, we can say they are the think tank of the industry. So next one is the sales and marketing. Pharmaceutical sales representatives are many in numbers working in a lot of industries. A lot of companies are there in India and worldwide. You can see they are directly in touch with their consumers and with the doctors and represent them their companies to their clients for their newer medications, for the updates, whatever they are the new products we are having, and the latest development they are getting in the format of it in the formulations. These positions are not required, particularly the pharmacist qualification, so that's a highly advantage for other PG or the other careers looking people who are PG graduates other than the pharmacy schools. So next one, most common in healthcare is hospital pharmacist. This is very typical job. While the hospital pharmacists work with the doctor and nurses to analyze the patient chart data in order to determine the appropriateness of medicine which is going to be administered to the patients. In addition, what they are doing is medical evaluation and help the monitor the patient, the recommend adjustments if any during the medication uh, charts. If you are looking at some DRP problem, then the hospital pharmacist, where the clinical pharmacist is adding their expertise or opinions while addressing the patients in the IPD or maybe in OPD. So this unique role plays them in healthcare industry. So next one, uh, the pharmacotherapy part also provide care and prevention measures in the public health tool and available sources for medication information chart to dispensing and the primary care suffering from the resilience to the patient recovery. All these factors are dealt by the hospital pharmacists in their different locations and for the need of the patient, need of the department. The pharmacist working in skin allergy or gynae or an ICU, the pharmacist itself is switching over to the different locations and the different to the people who are working aside with them in practice. So chief pharmacist is the oversee day-to-day activity of all the operations in hospital, including stocks, the need of the therapies, then whatever the formularies are there, what policies have to be generally done over there, and what clinical trials has to be done. These all decisions are taken by the chief pharmacist, and as per the duties, he can change according to the duties that he did. So, chief pharmacist is the position which is attained by a number of extensive experiences. Then he can to achieve some chief positions. Then pharmacy consultant. Pharmacy consultant use their expertise to advise companies and on creating policies, drug guidelines, electronic technologies, which means sometimes they advise on the patient also and the prescription they needed. This is the main role they stay updated on medical studies and technology to maintain. They can inform recommendations. So these are the positions which I am telling that directly associated with the pharmacists need to be registered after qualification, then he has to go some particular specialization experiences, then go to the industry, specific industry. After that, he attains some positions. These are positions which are not less than 50 lakhs in other countries. Annually, they are these are the salary package of these positions which I selected. Why I selected? Because when the pharmacist feels that this is a secondary education, so that's why I selected only those titles which are more at the higher variety in industry as well as in healthcare. So one more coming is the pharmacy informaticists. These are the pharmacists which are working in software development, databases, and AIs nowadays. Whatever the AI programs are coming, these are done by these specialists who are not only looking on the aspects, they also make some modules which are working in Accurate. We are just looking, you see, there are a number of softwares we are running in pharmacies, in research, and in, you can say, clinical trials, in toxicology, in pharmacology. So all these software are designed by these people. So one more most common that is a research type of position is available in the most of the tertiary care hospital pharmacologists. The next step up to the molecular levels and cellular levels, the pharmacologists come to play a role in as a specialty, and we do work on the stages, number of experiments, and from individual cell to the whole organism. The lab-centered role focus on discovering the pharmacokinetics, effects, and pharmacodynamic outcomes, eventually used rather than the device anywhere, which is available around the globe. So clinical pharmacist is uh, pharmacologist may is the best interested for those who are interested in research at the molecular level. They synthesize new discoveries in their lab setting. Specialization is extremely scientific and require knowledge every from biochemistry to the stats. So these are the positions which a pharmacist may good in their positions. So next one is the clinical pharmacy. This is the most common nowadays in India. Private sector is offering these positions to pharmacy people, but have come to all these positions not related to whether it is the graduate, masters, or pharmacy, or any other specializations. All positions are related to whatever you have additional diploma or you have additional qualification you attain for your particular specialization. So after that, you will get a registration in one particular field, and you have some particular days of experience. Then after that, you will go into your interested field of your positions. So clinical pharmacist is what the clinical pharmacist nowadays is doing. He's giving their a drug expert opinions. So he treated as a drug expert in the hospital. They work alongside the other healthcare team members like medical officers, nurses, pharmacologists, lab technicians, and pharmacists. So what they put their interventions as on medical therapy to optimize and appropriate recommendation will be required for the particular clinical situation. So recently, one more development has done in pharmacy that pharmacist is independent prescribing. So many countries have started the pharmacist is prescribing medications. UK is the first one who started. UK regulations allow the pharmacist to prescribe independently came into effect in 2006. The pharmacist independent prescriber may prescribe autonomously for any condition with their clinical competence. So clinical competence is what here. You need to have some additional competencies. You need some trainings, particular fields are there, and he should be pass those exam. After that, he is registered for the pharmacist independent prescriber. So the current excludes uh, some drugs which are related to psychotropic branch, and some injections are there. So those are not included in this. So pharmacist is also undergo some courses. This is the Royal Pharmaceutical Council, which is from UK, offers a accredited course in this field, and on successful completion. So what the person will get is will practice certificate as an independent prescriber, making eligible himself or herself to be registered in the this particular prescribing qualifications. So, as far as our Indian colleagues are concerned, these are the courses which is mentioned in GPC guideline, General Pharmaceutical Standard for the education and training pharmacists independent prescribers. This is the update for the 2022, and one more effort we have also done during the last decade. That 2015 we have introduced practice regulation, which is known by all of us. And as far as its authorities are concerned, its regulations are concerned, it is merely not beyond the counseling part, but we are establishing pharmacists to a consultation or opinion level specializations, but the authorities or PCI of India is not able to feel competent or feel proud on this that these are qualifications of PG and other people who would be competent to prescribe independently. So more discussions are going on with the government, with the PCI, and with the different associations regarding the prescription right in India too. But we are waiting for that the positive will come up, and for the positions which I discussed in my presentations, these are the internationally recognized positions, and they are not the positions which we have paid here. This is very competent and very highly paid professional positions. So now I close my today's discussion on this crowd feeding positions. So I was feeling that these positions would input our listeners to uh, mindset, to change their mindset, to go in specializations, to go ahead in international recognitions, so that we can enrich our Indian students, or make a confident themselves, as well as our neo coming colleagues, to be advocating pharmacy at the international level. No doubt we are good at the industry in world level. We are the third, every third tablet is from India. But in COVID, you see number of pharmacists work a lot and the physicians were working on digital prescriptions. And digital prescriptions were authorized in Australia to by the pharmacy. GP and pharmacist was giving digital prescriptions to the pharmacies, to the pharmacy technicians for the release of some medications which are needed at that time. So there are a number of situations are coming nowadays. Heavy rains are happening in most of the Himachal areas. Waterlogging happening in Punjab as well as also associated regions. So pharmacists need to be ready for those situations and be competent for waterborne disease, for viral number of viruses are going very effective nowadays, which are putting some pathological and the population of Punjab as well as other areas in a stigma of COVID spread also nowadays too. But we have some other viruses which are now in in their uh, in their in their full speed to go with some respiratory conditions like throat infections and some fevers. Nowadays, it is also seen in conjunctivitis eye infection also. So I close my words here and sincerely thank ISFCP for giving me an opportunity to interaction with this particular dialogue series. Thank you so much for all of you for listening me. Any queries, you can send your questions and your suggestions on the email which I mentioned in the last page. Again, I congratulate you all on 25th of September in the annual World Pharmacist Day. So with the theme Pharmacist Strengthening Health System. This is one of the word which is giving you confidence and growth that you are also incorporating health sectors and you are working in some areas of healthcare and you are supporting the public health programs. So I sincerely thank Dr. Ahmed sir and Dr. Salvatore and other faculty members, my students from ISFCP. Thank you so much, sir. And I wish you all the best for ISFCP. And feel anytime you can call me for any input like this, particularly influences. Thank you so much, sir.
Thank you, sir. Thank you, sir. Thank you for the wonderful session, and I hope the population and the students are going to be benefited with your thoughts and the content you have delivered in this lecture. Thank you. Thanks a lot from ISF College of Pharmacy. Take care.
Thank you, sir. Thanks.
Okay, sir. You can leave.